taken by tobacco industry in attracting them to the farming community. So I think this is simultaneously I am talking about the research as well. So we need to think ahead, because tobacco industry is a very strong is considered as very strong because of their muscle power, because muscle means like they have a capacity to influence because of the huge money which they have. So that is what we need to preempt now. And through this particular project, we aim to see how we can do a research, contextual research, maybe some qualitative research, asking people in the tribal community whether you are being approached by tobacco industry, for which you are approached. So we can have a qualitative research on this particular aspect, which is very less, and that will come only from qualitative inquiry. The second thing which tobacco industry is actually doing is involving the people who are actually tribals in smoking, taking smoking habits. I have seen that all the research, whatever is being there on tribal population, the prevalence of smoking is very high. In India, the prevalence of smokeless tobacco use is very high. One study shows that the prevalence of smokeless tobacco use is as high as 60%. So this means every less than every second, sometime every out of every three people, three tribals, two are taking smokeless tobacco. So this is very high. So we need to think about contextual research again, to go into the community and see what are the factors which actually lead them to initiate tobacco. That might be different from the community where we are living, where we have lot of things, lot of amenities with us, lot of peer pressure which is there. So what are the factors there? So we need to study those factors as well, and this will be one of the few novel studies which we think at this point of time we should conduct. And simultaneously, the studies on social determinants, because now the various social determinants actually play a very important role in uptake of tobacco, whether it's smoke or smokeless, or what is happening in tribal community about novel tobacco products, like we talk about electronic cigarettes. I hope and wish that it has not reached them, but we never know that if they take the habit, and the tribal community, and I think that AIIMS Deoghar, when they are studying the tribal community, I'm sure that my experience, a little experience in Himachal, so they are a very close knit community. They are a very close knit community. If somebody takes a habit, it is very easy for others to take that habit. So that social determinants of we need to explore, and we should try our level best on how the novel tobacco products or electronic cigarette should not come in contact. They should not come in contact with them, and we need to think on those lines as well. So these are the things, and again, couple of research have also shown that these tobacco industry is making use of these tribal community are being actually picked up from one state to another, because some state doesn't allow the tobacco tobacco growing, or even the making of tobacco, no? The curing of tobacco. So they are exporting the tribal community from one state to another. So again, we need to build a strong rapport with them, and actually convince them in such a way so that whatever things are happening to them, they should be able to communicate. So rapport building is really, really important, and initially it will be slightly difficult to work on, But I think AIIMS Deoghar, considering the reputation of AIIMS in the within the tribal community, I think it will be a bit easier. I'm not saying that it is easy, but it will be a bit easier to penetrate that community, to see their characteristics, social characteristics, their demographic characteristics, and I suggest for a targeted approach or targeted research for them. So I think this is the need of the hour. So, but I could not find many other strategies which are actually working. There is another one is influencing the tribal leaders to so that they speak in the parliament. I think Upendra Bhojani is here, so he might be, because he has collected the parliamentary question. So I'm not sure. I have not gone through them, but he might throw light on whether any question has been raised by the tribal community in the parliament on certain aspects. So I'm yet to see that, but I think that are other strategy which are used in other countries as well. So again, I think without taking much of the time, so I thank AIIMS Deoghar for this opportunity to present some of my thoughts, which I have gone through some of the papers, some of the literature on how tobacco industry influence the tribal people in getting things done. But luckily, we have still less penetration as compared to some of the other countries, primarily in African regions, where the penetration has gone into the depth. So thank you again. Thank you all of you.
Thank you, sir, for such a elaborative presentation on the topic. So I would now request, because Sonugal sir will be leaving us shortly. So if any question is there from the participant side, they can ask. We can take 1 2 questions. You can free to ask. Otherwise, we will take your questions and we'll personally text sir and we'll send you the answers. No problem with that.
I would have loved to be there for entire webinar because it's a very interesting webinar. But I'll be free by 4. In case that webinar extends beyond 4, I will join that.
Sure, sir. It will be 4:30 till 4:30, sir.
Okay, I will try to join at 4.
Okay. Thank you, sir.
Okay, thank you.
So, proceeding to further, share screen. Okay. So now I would again like to welcome our Executive Director and CEO, sir, Professor Dr. Saurabh Ashmi, sir. So he has been pioneer in the tobacco control research. Again, we are lucky to have him as our Executive Director and CEO in our institute. So, sir have conducted numerous projects, 28 projects, 368 publications. I have conducted tobacco research funded by the Union, Vital Strategies, WHO, and UICC. 8 fellowships, 30 awards or scholarships. Sir is member of recipient of Lance Armstrong Cancer Control Grant. Sir is member of NAMS, National Task Force for Medical Education, AIIMS Standing Committee of Cancer Control and Tobacco Control, and National Consultant for Front Food of Package Labeling. So, sir CV, if I'm going to read sir CV, it will take the whole day. So, without delaying further, I would like to request sir to deliver upon the topic, leveraging medical colleges for tobacco control among tribes. Sir.
Thank you very much, Dr. Vijit. I think today's discussion is going to give some ideas about the research focusing today on the research in the field of tribal health and tobacco control. So, as a medical institution, we have a certain responsibility, by the virtue of being a medical practitioner, to show. So, if we go by statistics, if we see that is GATS 2 survey, we'll see that as compared to all India statistical values, Jharkhand and Bihar, they have higher incidence in all type of tobacco consumption, maybe as a smoke tobacco or a smokeless tobacco. Now, if we take this further, so we thought that as one of our objective of our project is to sensitize the medical institutions and the professional bodies that have various associations about their commitment in tobacco control, because we know that tobacco is one ingredient which affects all parts of the body. So no clinician or practitioner or healthcare worker can say that tobacco does not, I do not see a patient which is affected by adverse effects of tobacco. So in that case, we all have to come together. We have to take our responsibility as ownership to sensitize. We have to be first aware, sensitize ourselves, then only we can pass on the message to the community. So one of the objective was that we have to go to various associations, conferences, and try to request them to give a session on tobacco control, where we have divided as a standard protocol our presentation into 3 segments, 15 minutes each. So we take them, we make them aware about the FCTC COTPA guidelines, we make them aware about what medical institutions can do and how tobacco industry is interfering in tobacco control. So we started the project just 1 year back, and since 1 year, various, including myself, have visited various conferences. Some name them. We try to target the national conferences as NAMSCon, ADPCon, International Cancer Congress, EDICon, Privicon, IPSMICon. Recently, we were at this is National Conference on Tobacco Health, which was held in Delhi just few days back. So, and upcoming in the month of March and April, our co-PI are doing in Manali in IPHCon and IPSM Jharkhand chapter, which is going to be held in April 2024. And further, we are going to line up various conferences where, and to our great surprise, that we had good participation attendance in these conferences. Until now, we could address more than 600 delegates in various conferences, because we are saying 600 because we give e-certificate after participation. So as per record, we have 600 people who have got their e-certificate, but number may be higher. Many of them did not scan the QR code and did not apply for. So we hope that it is a higher number. The second that what we did was, as a medical institution, that we realized that in Bihar, Jharkhand, it is that many of the medical institutions were not celebrating World No Tobacco Day. So 31st May, we know that it's a WHO call for World No Tobacco Day. So we contacted all the medical colleges, dental colleges of the state of Bihar and Jharkhand, and we requested them to send a proposal to celebrate World No Tobacco Day. That is, I'm talking about 2023. And to our great surprise, 18 of them, they responded. And we provided, we had a provision of giving them a financial grant of 10,000 rupees every institution. And to our great surprise, those institutes which celebrated World No Tobacco Day, 10,000 grant given by us, small incentive, but they had spent more than, and they had done it a more elaborate way, and hope they will continue this, at least they started celebrating. Then we only talk about, say, creating awareness when our people are updated and trained. Because we cannot say that we can talk to you if we are not updated and trained about the field we are talking about. So in this series, many of our co-PI, they have undergone various training time to time about the developments in the tobacco control. Say Dr. Santanu Nath, Dr. Vijit Biswas, Dr. Vinayak Murthy, Dr. Narasimha. They have been trained by different, that is by union at that time or WHO or novel strategies. So they keep on upgrading themselves so that we can impart the best possible information to people who we are addressing to. As mentioned earlier, that we are located in an area where tribal community is in dominance. So we are thankful to Honorable Minister of Tribal Affairs, Shri Arjun Mundaji, that we held a national summit on tribal health in month of May 2023, and he was a chief guest. And he announced AIIMS Deoghar as a center of excellence for tribal health. And in that, we are taking component of tobacco control and other addictions along with it as a commitment of the city. In the same continuity, to make our activity visible and to have a resource platform, we have created a website of our project by the name of AIIMS Deoghar, the Union Tobacco Control Project, which was launched on 22nd of September 2023. So if you want, you can log in and you can get the updated information of the project. Now, if we talk about burden of tobacco use among tribals, so we'll talk about research opportunities, WHO FCTC 5.3 guidelines, provision under COTPA, role of medical colleges. So justification of tobacco control among tribals. Why we talk about specific rural tribals? Because they are demographically very dividend. Because they are scattered. If we consider the map of India, we have a central strip of states which has a dominance, and after that it is a dominant in northeastern states of the country as Mizoram and other, where there is more than 90% population is scheduled tribe. Then higher prevalence of tobacco use, we'll talk about that. Our team has done a meta-analysis because there are various sporadic reports of various tribes of use of tobacco because they are geographically regional presentations. So our team has compiled all the information available for the last 10 years, and we have come out with a meta-analysis about tobacco use. And to our great surprise, the national tobacco use consumption is about 30%. As per this meta-analysis, it is 60% in the tribal community, which is a significant 2x time. The health disparities and vulnerabilities, last third workshop, we had discussed this in detail, that their health disparities are and the vulnerabilities are very, very different than non-tribal community. So we have to take them into consideration. And it is the economic implication because they live in forest area. They do not have much livelihood. They do not have very good economy for to sustain their health or get treatment, say possibilities, and limited access to education and awareness because they keep themselves very isolated from the mainstream. So it is very difficult to educate them and create awareness because they're not very open to the society and community. So these challenges are very important. If we talk about what is scheduled tribe, so if we go by Constitution, Article 342, the tribes or tribal communities are parts of groups within tribe community which the President of India may specify by public notification. So it is a defined community, and this keeps on changing from time to time. Because when the last census was done in 2011, when the population was 8.6%, at that time there were 705 tribes. But as per today, we talk about there are more than 805 tribes because the more have been notified. So this percentage of population may go up. So if we talk about a country like India, 140 crore population, so this will come around 10%, comes to tune of between 30 to 40 crore people are a tribal community. This is the meta-analysis we were talking about, and I would like to congratulate our team, which is done, which was mainly led by Dr. Narasimha and Dr. Santanu. So they have done this meta-analysis, and with this meta-analysis, you can see that the total incidence is about 60% as compared to the nation's tobacco control 30%, which is quite alarming. Because as per this meta-analysis, we had a prevalence of tobacco control ranging from 10% to 96% in the community. And if we did a meta-analysis, it comes to 60%. Can I have the PPT? To change weather? Either. इधर नहीं होगा। Sorry for this interruption. So if we go further, Ajay? So if we go by state-wise prevalence or different forms of tobacco among tribes in India, this is taken from publication PLOS 1, 2023, published by Murmu J and Agarwal. So here you can see that there is a state-wise distribution of tobacco, various tribes in India. And you can understand that since we are talking about Northeast, so if you focus all India, as per this article also, it was 19% smoking and 32% smokers tobacco, and another tobacco 46% in the tribal community. So we speak much more incidents about, we talk about Bihar and Jharkhand in particular. You see it's a higher, almost 60% in Bihar and almost 47% in Jharkhand. Now, weighted prevalence of different types of smokers tobacco, we have already discussed this. So it is much higher use of henny or tobacco lime mixture and followed by gutka, tobacco limes, areca. It's like that they use. Now, what are the research opportunities and its translational value tribal tobacco use? To be very honest, very less work has been done in use of tobacco in tribal community. Why I'm saying less? Because it's very sporadic population. They are not easily accessible. They are not open. It's not easy to take history and collect data. So that's why less work has been done. So the burden of use, what we just mentioned, the meta-analysis, we range from 10 to 96% itself, the data becomes questionable. So we have to have the real assessment of the burden of use. That can be one research area. Then determinants of use. We know that there is existing court toffee guidelines, but we have to make them aware. Cultural factors, as we have been conducting various this virtual workshops, you have to come across that there are certain cultural norms acceptable in the community that they do not consider as addiction. That is, if somebody has any type of pain, they give tobacco water for relief. If females have say menstrual pain, they take tobacco water for relief. If in various cultural festivals they serve and exchange tobacco water as a cultural norm, so it is so much embedded in the culture. It is, we have to talk about the cultural factor, and changing the cultural belief and factor is the most challenging part. So we have to work some strategies to make them understand that how they will require to change the cultural habits. Then stakeholder perspective on designing tailored interventions. Now, as we mentioned, there are 805 tribal communities. Almost all of them have very different beliefs, different culture being followed. So it is not easy to make a universal guideline which can be implemented on that issue. So we have to make certain percentage which is universal, and then we have to make tailor-made intervention perspective for those community if we want to really see a good outcome. Then we have to have implementation research to be thought about, that we have certain things which do exist, but we are not able to implement because certain barriers or restrictions. So we have to understand what are those barriers. Language may be a barrier, custom may be a barrier, say economic reasons may be a barrier. There may be various or non-availability of resources itself may be a barrier. So we have to talk about existing facilities available for cessation. If we talk about, they are very, very minimal. So we have to give them access to cessation facilities when we ask them for cessation. Then leveraging medical college for tobacco control. Now we know that Government of India has increased number of medical colleges in the country, and few of the states, they have almost in every district. So I think it becomes a big responsibility of the medical colleges to take the responsibility of tobacco control. and for the implementation and as well as monitoring also of the practices which are to be implemented. Now, impact of tobacco use among tribal, it is, we know as a healthcare worker, the health consequences, we are aware that we have to understand the economic burden. Recently, our team, which included Dr. Janvi, Dr. Ashkar, and Dr. Vijay, they went to tribal community and have a focused group discussion. And from there, they came out that they're not earning anything, but they're spending, I was told, 5 to 8 rupees per day on tobacco, which cost about 150 to 200 rupees per month. But they do not have money to eat, but they have money to spend on tobacco because they have a belief that using tobacco gives them energy and strength to work more. And so these type of beliefs are to be taken besides economic burden. Then cultural, I said that they are in a very shelled cultural beliefs, and they have a lot of faith on their faith healers, which are within the community holding the gates for others to enter. So we have to take them into confidence. We have to, we cannot bypass the faith healers. So that is also one we have realized. Now, tobacco industry interference, we know that tobacco industry interference is, what we mean here is that whenever we talk about tobacco control, the tobacco industry is a very strong lobby industry, which contributes a lot in economy of any country because in the way of taxes. So they have a lot of hold in various arenas in the government and non-government organizations. So they try to influence people that if they know that their product is doing harm, they try to cover up by doing some social welfare schemes so that people remember more of the welfare schemes rather than the harm of the tobacco. So that we call tobacco industry interference. And we all know that tobacco is the only legally available consumer product which kills people when used entirely as intended. 275 million tobacco users reside in India. And this is as per the publication of 2018. So how tobacco industry influences tobacco control is they support, they try to present that they are supporting sensible legislation and we are here to help. Now, whenever any drafting of any legislation is done, the stakeholders or the end users are always taken into policy making by Government of India. So there they try to make, they agree to certain points, and then they try to find the loop in that legislation which has been created by their suggestion. Second is the new lobby group out of the blue. Recently, last year, the theme was that grow food, stop tobacco. So there were a lot of rally marches on the streets by the farmers that most of them were instigated by tobacco lobbies only. So that the attention is diverted from the main theme and goes to the economic concern of the people who will give up farming of tobacco, so that the issue is diluted. So every time we talk about something, new lobby crops up to talk against it. The invisible editing hand. We know that many times the policies are influenced not only by members, they're not even member, but they have invisible hand in influencing the policies. That we strongly support youth prevention program. We all know that Wills Cup is held by Wills. We know that Station Coffee's Classmate is a brand of ITC. We know that certain hotel chains, they are brand of ITC. So they are trying to say that, okay, we support and help youth in the CSR way. And one hand, they are harming them from advocating and making product available, which is harmful for their health. The never-ending committee process, that if a committee is formed, they will make some issues raised and subcommittees created, and the issue gets diluted or diverted subsequently. And definitely money talks. If we talk about many of the publications related to tobacco control, they are in the tobacco industry. So if one relevant study comes up, we know that the first causative effect of tobacco as carcinoma lung was published in BMJ in 1962. Before that, we were not agreeing to that carcinoma lung is mainly caused by, today we say 95% of the cases of CA lung are due to smoking. So those things, then they contradicted by bringing out 2-3 literature publications which are funded by tobacco lobby. So this is how they do. Now, tobacco industry interference overall country ranking, if we see by Global Tobacco Industry Interference Index 2023, so India ranks somewhere in between, very high ranking and low ranking. But if we see to other developed countries, India ranks slightly better than them. If you see the color coding, you can see here that I think this slide, I'm not, because the slide given by Dr. Vijay, so I'm not able to explain this slide exactly. It's 58. Okay, yes, I was trying to find 58 is here. Scoring is 58. So between the color coding, it is the lower the score, the better the ranking. It is lower the score, the better the ranking. So you can see that our score is not a very, very encouraging one here. Now, if we compare 80 countries between 21 and 23, which was published, so our scoring has gone down because recently IIT Delhi signed an MOU with ITC to support research, which was a huge grant. So if you take any grant from tobacco industry, your scoring is going negative side. So that is what has been. So now, when we talk about FCTC, we know WHO has brought out FCTC Article 5.3. It has basically 4 principles. The first is that there is a fundamental and irreconcilable conflict between the tobacco industry interest and public health policy interest. Second is parties, when dealing with tobacco industry or those further its interest, should be accountable and transparent. Third is parties should require the tobacco industry and those working to further its interest to operate and act in a manner that is accountable and transparent. And last is that should not be granted incentives to establishment of their business. Now, what in nutshell Article 5.3 is that tobacco industry is not allowed to interfere, has to take interest of the health of the community, and if any hazard is being done, they should be accountable in a transparent way, and they should not be granting any incentives to in any form to anyone. This is what Article 5.3 is. Now, how to implement Article 5.3? There are various attempts, recommendations. That one is what we are doing today. We are raising awareness about this interference. Now, what is awareness? That we say that people who are selling something which is harming your health, we should be totally boycotting any support or incentive or financial grant given for any activity. That should be the awareness. Second is limiting interaction with the tobacco industry, that we should not be having any interaction with the tobacco industry, particularly medical institutions and any health professional training institution. Third is rejection of partnership and agreements with the industry. We should be avoiding. Avoidance of conflict of interest. Require disclosure of information by the tobacco industry to promote transparency and denormalize tobacco interference cause CSR activities, and do not give any benefits or tax exemptions if any grant is being taken or given to anything related to tobacco industry. Now, what is COTPA? COTPA Act was brought in 2003 by Government of India, and the Section 4 says that prohibition of smoking in a public place, smoke-free area, but unfortunately there is a lot of debate and discussion in public space, because public space definition is not very well defined in the COTPA. Section 5 is prohibition on advertisement of tobacco products. 6A, sale of tobacco products to and by minors. 6B is prohibition of sale of tobacco product in 100 yards of education institutions. Section 7, that warning labels, in the Government of India, we have 75% depiction on the tobacco products. We know. Section 12, power of entry and search, and Section 13, power to seize, because there are listed penalties and judicial rights also, which can be taken as defaulters. Now, with the penalty clause, Section 4, 5, they have been mentioned. Now, problem is recently we conducted a training session for this department of our district, and it was a request by the police chief that many of our police officers are not very much aware about COTPA guidelines and rights they have. So because they are authorized to put the penalty, so we need to create awareness among the people who have given the responsibility for penalty. Now, these are something we have to talk about. These are 75% depiction of picture depiction. Then we have to display these in the medical institutions or public areas, or where we can create awareness about the COTPA. Then, as AIIMS Deoghar, we have been conducting these regional virtual workshops. We have planned 5, so we are conducting this as 4th. The first one was conducted based on burden of tobacco use in tribal community, and the key points that it's deeply rooted in their culture, practice, and tradition. Notably, in the northeastern region, the prevalence of tobacco consumption is higher among women. Innovative strategies and engaging youth is very much required and is viable. Overcoming on ground implementation obstacles is essential to activate district tobacco centers, and adoption of COTPA and TOFI. TOFI guidelines are basically what we are talking about, that the teaching institutions, 100 yard, nobody can be allowed to sell tobacco products. Given the remoteness of tribal settlements, necessitating tailored interventions, I have already mentioned that what to talk about. The second virtual workshop was focused on cultural determinants of tobacco use, which was on 27th October 2023. And we realized after the workshop that myths and health benefits are to be considered. A historical acculturation of foreign products, cannabis and opium introduced by external influences, became integrated into their rituals, ceremonies, and day-to-day activities. Transmission of customs to younger generation, because tribal community is a close community, so traditions are passed from one generation to another, so they keep on passing on from generation. And addressing cultural influences and marketing is another thing we have to look into. The third workshop was conducted on 24th November 2023, and the theme was challenges in policy implementation, where we realize that there are many government India policies, but how we are facing challenge in implementing it. So it was discussed, and the outcome was that there is a lack of customized interventions, language and communication barriers, because many tribal communities still they have their own language of communication, so you cannot interact with them with the normal language me and you speak. So those barriers are to be taken up. Socioeconomic factors and community mobilization, because they are migratory, many times they are migratory population. And community participation, including tobacco control in Gram Sabha discussion agenda, that particularly it was suggested that it might be some innovative strategy to address the issue. Out-of-box thinking is required in these strategies. Besides this, as I mentioned, that we have been talking about tobacco control in various national conferences, and this is last but one where we participated. We got out of 531 e-certificate issued based on their feedback. We saw that the awareness regarding COTPA was 60% before the workshop, and it went up to 75 after the workshop. Then second hand, the awareness regarding tobacco industry interference was 63% before the workshop and went up to 96% after the workshop. If we talk about awareness regarding Article 5.3 of FCTC, it was 40% before workshop, went to 60% after the workshop. And awareness regarding anti-CP implemented states, it was 24%, went almost double to it. That is what we can see from this. And ever attended an event sponsored by tobacco company was 25%. And you can see that effect of sensitization at national conferences and virtual conferences was statistically significant. The awareness we could generate in the participants was significant. So this was an encouraging thing to talk about. And our team took an initiative to start with FGDs, relative focus group discussion. And our team went to the tribal community in their vicinity and locations. And it was, I would like to congratulate Dr. Bijay, Dr. Arshad, and Dr. Janvi. Particularly three of them, they went to those villages and they interacted with the people about tobacco control as a close community discussions and tried to bring out things. And they went to tribal districts. And these were some of the data they have collected with the people they have interacted. And the result of these FDGs was the burden pattern creates tobacco use, how gender influenced tobacco use. And males, out of every 10, male was a tobacco user in the community. Most of the males in the village use tobacco. Some don't prefer to, but one who initiates continues. And the young females normally don't use tobacco. But I heard that some wives tobacco from their husband pouch to consume tobacco because still the female do not have access, direct access to tobacco, but there were female tobacco consumers also in the community. So this was the word cloud of transcripts of focus group discussion of the MDG result. Besides this, we had one objective of advocacy meeting with stakeholders because we have an objective to make 100 yards, that is a 91 meter periphery of Baba Dham temple, which is, I think, iconic entity of Deoghar, tobacco free. So in that meeting was conducted with the district administration. Dr. Sudeep and his team have been taking this initiative further. So they met the district administration, briefed them about the objective aspects of tobacco control and the help required from them. And after this meeting, it was concluded there is a lack of administrative awareness, school awareness and monitoring, leveraging upcoming government programs and compliance surveys. But compliance survey is a part of our one of the sub-objective also. And we are thankful to Mr. Deepak Mishra, who is head of schemes. We are in taking their help for this compliance survey, and we already had first discussion with them. Then it was second meeting of DTCC, which was called on 29 January 2024. And it was, I think, after a long gap when the DTCC meeting was Then the second advocacy meeting, the workshop was conducted at AIIMS Deoghar. We invited the district administration, the chairman of Chamber of Commerce, the Indian Red Cross Society president, police chief of the district, even Baba Dham Mandir trust representative in that meeting, and we tried to discuss how we can fulfill our objective of making 100 meter of periphery of Baba Dham tobacco free. And the work has already started on this decisions taken here, and majority that agreed to the concept of making it free, they committed their full support around this. They said they will put the signages. IMA took the responsibility of putting signages, IC material, toffee guidelines to be advocated. The municipal chief also there, the municipal commissioner of the district was also there. So he said that he will take up the responsibility, and it was thought that we should put an appeal to the community also in the newspaper for the needful. The proceedings were published in the national dailies, and we are also, because the project is based in Bihar and Jharkhand. So what we are doing is that we have mapped the medical colleges, dental colleges, and paramedical and nursing colleges of both the states. and we have tried to make them at the consortium. And out of all the medical colleges, we have been approaching them in various ways by repeated email, calls, and all that. So we could succeed in bringing 24 medical colleges together on one platform, both the states. And there was a survey conducted by our team, which was led by Dr. Vijit. And we surveyed almost 8,000 people, 7,700 people, the healthcare workers of various medical colleges. And it was an online survey, and which gave us the incidence of usage of tobacco ever, current or daily. You can see from the slide. So as per GATS 2, it was overall was 28.6, in Bihar 25.9, Jharkhand 38.9%. And that in the same study, we asked people that their knowledge about smoking not allowed in public places. So you can see from the slide that almost 64% they had the opinion that in public transport they were not very convinced, and out of this we divided tribal, non-tribal. So it was more among tribal and 63.6% in non-tribal community. If we also assess the knowledge about sign-in mandatory in public places, the opinion was very, and but if the most interesting was that if we want to put a prohibition on tobacco, that what should be the strategy? So many of them, they you see that they said that warning display of tobacco products was not very effective, and they said the best way to put the prohibition is to put penalty. So that was something surprising, that we were thinking that we make people aware the consumption should go down. So it was not so. And we also talk about incorporating tobacco control in the curriculum of medical education. So as per the feedback, almost 96% of the dental student, 94% nursing student, and 93% of the medical student, they agreed for the curriculum inclusion. And it was almost more than 70, or almost 75% the faculty also of the three streams that it should be part of curriculum. And so the conclusion is our research reveals disparities in healthcare tobacco, age, gender, marital status, occupation, income, and native state. Higher knowledge related to CODPA is more in non-tobacco users than the tobacco user, which is a very surprising finding. And notably, tribals had comparable knowledge regarding legislations, higher age of initiation, and integrate tobacco education curricula was recommended by all. So, as a medical, what we should be looking at, we should be having clinical services. I'm happy to say that AIIMS Deoghar provides clinical services for addiction patients in the form of we are running addiction treatment facilities being managed by Government of India. And soon we are trying to say enhance those facilities for the indoor patients also, where free consultation, free treatment, free counseling is done for the patients who have any type of addiction, including tobacco. Then we should declare our campus as a tobacco-free campus. AIIMS Deoghar is made a tobacco control cell of the institution, and we are focusing to make and almost succeeded making our campus as a tobacco-free campus. We should be building partnerships with our other agencies who are working in the field of tobacco control, and we should be conducting some research, and we should be having either collaborative research or our research standards or statistics to talk about education and training, capacity building, and our tobacco control cell and our team has made awareness among the students, among faculty about as the capacity building. IEC and community participation very much required. National Tobacco Control Program, although exists, needs some monitoring and evaluation for improvement, and advocacy. What we are doing in various medical colleges is what is expected. So the take-home message will be create awareness among student, patient, communities regarding the effects of tobacco legislations. There should be display of signages, because we know that out of 5 visual senses, the most strong impact is sense. So as many times you show them the harms of tobacco, they will be remembering. upload conflict of interest statement on website. Here, conflict of interest statement means that we had requested all the medical institutions in Bihar, Jharkhand to put on their website that they declare as a conflict of interest that they will not be accepting any grant or support in any industry which is related to tobacco.
हम क्या करेंगे सुन
That 18 medical colleges and 6 dental colleges, they have uploaded till now. And recently we were in the tobacco conference. So in this International Institute of Health and Management Research, they also agreed that they will also put up on their website this conflict of interest. So I will be requesting those who are joined us, kindly put it on your website as a conflict of interest, that your institutions agrees to this, that you will not be accepting any support from any tobacco-related industry. Elicit and documentary history use among patients and linking of tobacco patients to de-addiction facilities, as I mentioned. So thank you very much for your kind patience, and over to Dr. Vijay. If there are any questions, I think you can either raise your hand or you can put it in the chat box so that Dr. Bijit can read them and I can take the questions. Thank you.
So thank you, sir, for such an elaborate presentation, which highlighted the importance of tobacco control among tribal and indigenous communities, and also highlighted the work which you have done by engaging medical colleges to achieve the tobacco control among the tribal communities. So with this, the stage is correctly set for our panel discussion. So I am myself Dr. Vijit Biswas, a assistant professor in the Department of Community and Family Medicine, AIIMS Deoghar. So I'll be moderating the session. So we are glad to have with us Dr. Deepak Mishra, sir, who is Executive Director of the Socio-Economic and Educational Development Society, SEEDS. So Deepak Mishra, sir, has been working in tobacco control more than 25 years. He is a master trainer for tobacco control managers and government official. He is having good rapport with regional and state vernacular media. He is have active involvement in instrumental in banning of manufacture, trade, storage, and sale of tobacco products like gutka, pan masala. He is member of Task Force Constitution for Nasha Mukti Abhiyan by Ministry of Health and Family Welfare. He is member of State Tobacco Control Coordination Committee in the state of Jharkhand and Bihar. Welcome, sir. I would also like to welcome Dr. Shivam Kapoor, who is currently Technical Advisor Staff at the Tobacco Control Division of Vital Strategies. He has over 10 years experience of tobacco control. He has been working in, he has more than 50 publications on research projects related to tobacco control. He has joined International Union Against Tuberculosis and Lung Disease Union in the year 2019, and now currently successfully working for Vital Strategies after the transition. He has certifications, fellowships in the epidemiology, GIS, and tobacco control. Welcome, sir. So I would also like to welcome my fellow colleagues, Dr. Shantanu Nath, sir, who is holding the post of Associate Professor in the Department of Psychiatry, AIIMS Deoghar. He is currently heading the department also. So, sir have four funded projects to his credit and more than 48 publications and 3 book chapters. He have recipient of numerous awards like Young Scholar Award, Pune Psychiatrist Association Award, and India Psychiatric Society, etc. So, welcome, sir. So, I would also like to welcome Dr. Pragati Hebbar, ma'am. She is a dentist by education. She has completed his Masters of Oriental Medicine and Radiology from Rajiv Gandhi University of Health Sciences. She has been working in tobacco control for more than 12 years and has co-authored more than 22 national and international peer-reviewed scientific publications. We are very glad to have you with us, ma'am. So welcome, ma'am. So now I'd request the technical person to plug all the panelists to a same screen so that we can see each other. John. So I would request all the panelists to kindly switch on their videos so we can see each other for a fruitful panel discussion.
Dr. Vijit, I have already switched on my video, but I think some technical glitch is there.
Okay, sir. Okay, sir. No issue, sir. Uh, so we continue with the panel discussion. So I would first like to start with Deepak Mishra, sir. Sir, SEET has been actively working in various community-based and groundworks. So how do you perceive the role of NGOs like SEEDS in addressing the tobacco use among tribal and indigenous communities? And which strategies have worked and shown to be fruitful for tobacco control among them? Sir, can you please elaborate?
Well, first of all, thank you, AIIMS Deoghar, for inviting me for this important panel discussion on the important issue like tobacco control, which is generally neglected in our country. Actually, as far as this tribal communities are concerned, I'll tell you, community engagement activities along with the effective implementation of tobacco control laws with support from the community are important to address exposure and use of tobacco by the tribal community. It is also important to address the context and cultural aspect of indigenous and locally made tobacco products. And in this, any NGO or CVOs can play a very vital role in disseminating and working with the community and addressing the behavior-related substance abuse, including tobacco use. So, apart from that, dedicated communication strategy for tribal community with vernacular media, mass media, and IC, effective IC campaign have been effective in communicating the adverse impact of tobacco use among the tribal community. And more importantly, engaging the village community and PRI members have also been helpful in communicating the harmful effect of tobacco use to the tribal community. These are some of my thoughts. So, in case anybody want to add on this.
Thank you, sir. So now I would like to come. We would like to hear from you more, sir. So this time mainly we are focusing on the research opportunities and its translational value on tobacco related to tribal tobacco use. So we would like to hear from you more, sir. So now
Okay.
I'd like to my next panelist. I will coming to you for the next set of questions.
Okay.
Now
Yeah.
I come to our next panelist, Dr. Shivam Kapoor, sir. So I would request Shivam Kapoor, sir, and Pragati Verma, if possible, to switch on the mic. Deepak Mishra, sir, there's some technical glitches there, but other panelists can keep switch on their mic. Videos. So now coming to Dr. Shivam Kapoor, sir. So are you there, sir?
Good afternoon. I'm
Yes, sir. Now I would like to ask you, could you share some successful strategies or researches which have been implemented by vital strategies addressing tobacco control among the tribal communities? And how can these be scaled up to replicate in other regions? Some successful stories we would like to hear from you, sir.
sure. Firstly, thank you and good afternoon, one and all. And my apologies for not switching on the camera. I
All
think there
other
is some.
participants kindly switch off their mics. It's hindering the workshop.
Sure. Thank you for inviting me here. And I think as Deepak ji had already set the stage, I'd like to share two particular instances of intervention among tribal communities, which are directly or indirectly interlinked with how tobacco control has been achieved. First example I would like to give from an organization and a civil society working in West Bengal who is a Vital Strategies partner called Month. There's an effective tailored strategies and intervention that had been done, in which tobacco cessation efforts with tuberculosis awareness have been integrated. So primarily, I would like to discuss how this model had been achieved. This was primarily done through the use of community media by utilizing community radio and video in the tribal languages that ensured that the message is accessible and resonant with the target audience. Secondly, there was also involvement of traditional leadership. And when I say traditional leadership, it means involvement of tribal leaders, wherein the organization, the Civil Society Month, had leveraged the existing social structure and respect for authority within the communities. This helped in legitimizing their efforts and also building it like a relatable social model for the tribal community. Third strategy was by integrating TB and tobacco awareness together. This, like I said, not only was focused on tobacco control, but also on tuberculosis awareness. So it could address two significant health issues together. And lastly was engagement of tribal youth clubs. Now this, since it's the time, it empowered the youth among the tribal population. So it gave a sense of ownership and empowerment among the young leaders from the tribal community. So this is one example how integration of tobacco cessation efforts with TB capitalized on existing health concern of the existing community. Uh, Next example I could just share briefly. It is not out and out focusing on tribal population, but since under the tobacco control department of Vital Strategies, we do have targeted projects at district. And when the compliance assessment is done, I could see one of the participant had shared in chat that if all the states in India are having the Kotpa ban, so under these objectives we focus on certain project districts in a specified period of time, so that this law is implemented better. And while doing this, we have some concept called as declaration of smoke free areas. Now these could be smoke free jurisdictions, smoke free cities or districts. So I'm giving you example from the state of Jharkhand, where Deepak ji had been working through seeds, and another example from the state of Chhattisgarh. So as I can name a few districts in the state of Chhattisgarh, we have already smoke-free declaration of district Sarguja and Jashpur city within the Jashpur district. Now these are the two districts within the state of Chhattisgarh where Bihor and Korwa tribes are living. However, I can still say that the focus was largely on a broader area, but not encompassing that, we have not focused how much of the tribal people have been, really uh, following it up. It is overall for the district. So that is the smoke-free declaration. And from the state of Jharkhand, there are three districts that have been declared smoke free, which have some tribal population. One is Goda, one is West Singhbum, and the other being Khunti. So I think these are the practices through partners which we have achieved, which are successful interventions. So yeah, I'll stop here. If there are any questions, I'll be happy to take.
Goda is predominantly tribal community, sir, with more than 30% tribal people are living. It's part of Santhal Pargana. So now I would like to come to my next panelist, Dr. Pragati Hebbar, ma'am. So ma'am, are you there, ma'am? Pragati ma'am? Pragati ma'am, are you there? Am I audible, ma'am? So meanwhile, we could connect to Dr. Pragati. I would like to invite our next panelist. Ma'am, Pragati ma'am, are you audible, ma'am? Am I audible?
जी 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 जी
Okay, okay.
सही है आपका
किसी और को plug in किया है. Ma'am, I think some name here is there. Can you switch on your video? Ma'am, could you please switch on your video? We could able to identify them. Okay, ma'am, we can continue. Am I audible, ma'am? Pragati, ma'am, can you please unmute and
हाँ जी सर जी सर
yes, 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 ma'am. So my question to you, ma'am, is that what key policy interventions are needed to effectively tackle tobacco consumption among tribal populations? So, like, we are mainly like to know from you what the implementation research opportunities that we could formulate that could streamline the existing interventions in the tribal population. So, ma'am, could you please elaborate? Ma'am, am I audible, ma'am?
sir your voice is breaking
Okay, ma'am.
I think there is a
please
confusion.
write a question in chat box that I will read and give answer. I can't understand.
Okay, ma'am. I am again repeating the question. Am I audible? Clearly audible now, ma'am? Pragati, ma'am?
I think Dr. Dixit, you are asking.
Ma'am, I think there is some connectivity issues because from our side it is very clear, madam. So I think I can meanwhile invite our next panelist. Ma'am, can you please check your internet connection? I think there is some problem. So I now coming to my next panelist, Dr. Shantanu Nath, sir. So I would like to ask you, sir, that what specific research opportunities exist in studying tobacco use among tribal populations in India, and how can these opportunities be effectively capitalized on to inform the tobacco control strategies? Sir.
I thank you, Dr. Beju, for inviting me to be a part of this panel discussion on tobacco or contributing tribal population. So I've been hearing to Professor Sonu Goel speak on tobacco control, the road traveled so far. Mr. Saurav Vashne, sir, ED sir, regarding the leveraging of medical institutions. Deepak Mishra spoke on the role of NGOs. Even Dr. Shivam Kapoor also spoke on what vital strategies had done in the state of Chhattisgarh and also part of Jharkhand. So since the topic is the research implementation, like lot has to be done. That is one that we can get. First of all, we have to identify that this is such a community, such a population which is difficult to reach. So, and also data is very scarce. As Professor Varsha has shown that we had done a meta-analysis in which we could ultimately tap in full 37 studies, the prevalence studies, and we came out with something like 60% prevalence of tobacco use in tribal population. When the strategy, we couldn't find more than 100 studies related to tobacco use in last 10 years in PubMed and other two search engines that specifically dealt with tobacco use in tribal. So multiple reasons can be, and here comes the opportunities that we can think. Because of this is something a new arena that like tobacco control in tribal population, and it is difficult to reach areas. I think qualitative studies can play an important role more than quantitative when it is something to start with. Like as we have already mentioned that our team has done some FGDs in some of the tribal villages. So we need to have some idea regarding the knowledge, the burden, the practice of it. That is the basic that we can do while we try to invade into the understanding of tobacco control and tobacco use in tribal. Secondly, as our previous speakers were also mentioning about, like even the ground reality implementation of the laws regarding COTPA, regarding like FCTC 5.3 by WHO, the National Tobacco Control Program, how much ground in reality wise we have implemented and made an infringement in the tribal, that is one that needs to be studied. Third, as a part of qualitative analysis, we can also look into the cultural acceptance, because we have been discussing in length regarding giving tobacco laced waters for treating toothaches, menstrual cramps. So what are the other customs people have from the tribal areas when they are using tobacco? in their part of in their life. The cultivation and livelihood, sir has been mentioning about they are spending 150 rupees per month. So how much is the economic aspect of it, how much is that 150 rupees meaning to them, and what is the total economic burden for them? That is one thing that needs to be dealt with. Apart from this, issues related to the quantitative studies, we are about to come with that meta-analysis in which we have found out 59% about to get published. But related to go into the quantitative, we must first have to cross the barrier for having qualitative research. Because after we have a proper idea, like what are the gaps coming out from qualitative, we can identify those particular high priority areas where quantitative studies can be done. And as a ground reality thing, we can tell from AIIMS Deoghar platform is that sitting in Jharkhand also, we don't see too much of people represent the tribal population who are coming to the hospital to take help. So even if the hospital is located in a tribal predominant area, we are not getting that much people who are coming to us who belong from a tribal or indigenous population group in India. So hospital-based studies will lead us to nowhere. So it needs more of community-based studies, more of going to their communities, their areas to identify the needs. And this is what I have to suggest. Thank you.
Thank you, sir. We are now trying to connect with Dr. Pragati Jabbar, ma'am. So, ma'am, I think it's now
Hello.
audible.
Yes, I'm here. I hope I'm audible.
Thank you, ma'am, for joining. So, we would like to ask you that what key policies interventions are needed to effectively tackle tobacco consumption among tribal populations, and how can research findings contribute to policy formulation and implementation?
Yeah, thank you, Dr. Bishwajit, for this question, and also to the organizers, AIIMS Deoghar, for putting together this important discussion with a focus on tobacco control in tribal populations in India. So there's indeed no simple answer or a single answer, because tobacco control, even in general, is quite a complex policy area. Like many of the previous speakers alluded, we need to have data that looks at the population that we want to work with. So, for example, one of the studies at our institute looked at the national NSS consumer expenditure survey. And we see that from 1980s to 2012, although there has been a reduction, but there are significant gaps between scheduled tribes, scheduled caste, OBCs, and others. So this clearly indicates that a lot more emphasis and focus needs to be diverted to this area among tribal populations. Some policy interventions that I could think of are, one is related to cessation and health services provision. Just like the previous speaker mentioned, that even the uptake from in a tribal dominant area also is not that much. What I would like to say is that having embedded presence in the setting is extremely important. So for our example, there is one intervention called Hosa Jeevana, which is a tobacco cessation clinic, basically, but it works in an embedded way within the settings in remote forest dwelling tribal areas. So having people from the community itself, because the acceptance might still not be there. So how much do they trust people who are not from their community? That over several years of journeys that they've had. So it is important to have people from their community deliver services to them. The issue of language was also brought up. So the tribal population is not homogeneous. As we know, there are several different tribes, each one with their particular identity, norms, dialects, etc. So that's why it becomes all the more important that we tailor our interventions. Otherwise, the one size fit all will not reach them. Lastly, I would also like to briefly mention a bit about research, since your question alluded that how could we go to, translating research findings. So one suggestion is to not restrict ourselves only to large-scale national data sets where all of the tribal identities get clubbed under scheduled tribes, but to rather conduct more granular or ground-level research, more of a bottom-up approach, qualitative approaches, to understand that what does tobacco mean to them? How has it been perceived in their settings? So, because there is also documentation that says that tobacco is often exchanged in their ceremonies, it's also sometimes offered to deities. So when such practices exist, what is the reasoning behind that? And that would help us move or translate research findings into how we can try to get them away from such harmful products. Lastly, I'd like to add that one example of such an embedded research of an anthropologist who is undertaking doctoral research, and he's trying to study what are the socio-cultural and historical pathways of tobacco, alcohol, and other substances in these forest-dwelling settlements. So I think just to close, it would be to focus on our health literacy interventions, on how we do our research, and how we provide cessation and other services to these communities. Thanks.
Thank you, ma'am. We'll like to hear more from you. So now we're coming to the second set of questions. So now I will again, before coming to the second set of question, I'm going through a research today morning that have compared the secondary analysis of GATS1 and GATS2, and as per the NTCP implementation status. And surprisingly, it didn't find any difference when NTCP implementing state or non-implementing state. So Deepak Mishra sir is we are working for seeds and working actively in the ground in the tobacco control. So I would like to know from sir that what methodologies or approaches have shown promise in conducting research on tobacco use among tribal population, and what strategies we could adopt to refine our research in the tribal population, sir.
Well, Dr. Vijit, as mentioned by our previous speakers like Dr. Pragati and Dr. Shivam, I mean, the tribal community is, they are diverse with the diverse languages and the cultures and the diverse varieties of tobacco users as well. So, Jharkhand is such a place where the tribal communities are of different kind of, like in Santhal, the different type of tribes are there, and in Kolhan and Chotanagpur area, the different culture and different languages are there. So qualitative research studies with interviews and FGDs with different groups and subgroups within the tribal community is very important. That's way. Another thing is engaging with the community in the research. It would be very helpful, and an important aspect of the research outcome to be helpful to the community and the policymakers as well. And then the research focused on behavioral aspect, a specific product aspect, and a population setting. For example, women and children should also be considered in the sample. So that will be great, and that will be better, because in the part of Chhattisgarh, Kolhan area and the area which is the bordering of the Chhattisgarh, I mean, there certain product called gurakus are being used as a tobacco product, which is not the case in other part. So it would be better that quality research studies should be conducted by involving these local communities. And of course, again, I'll emphasize on the role of CVOs and NGOs is very important, because they are the people who are connected with the local community, and they are the people who can gather the evidences for any research in this process. So thank you.
Okay, thank you, sir. So what I have told, sir, we have similar kind of experience with our research, qualitative research, what we have done, because we have, due to constraint of time, we have chosen a mixed population of males and females, where females didn't accept it that they use tobacco in front of their male partners. So,
because in Jharkhand, what we observed during our, because since our team have is working since almost last 10, 11 years now. And our team worked in the place like Lohadagar, Khuti, Ramgarh, Godda. So, I mean, these are tribal, Dumka, Hazaribagh. So, these are all tribal dominated districts. And Gul is very prominent among the smokeless tobacco. And that is very popular among the women, and even the small girls are using guls in Jharkhand. So these things are very peculiar if you compare with other part of the country among the tribals.
Sure, sir. Sure. Thank you, sir. So I would now like to come to our next panelist, Dr. Shivam Kapoor. So, sir, I would like to know what are the key challenges in translating the available research findings into the tangible outcome to bring about the policy changes. So, being working in one of the leading organizations on tobacco control, I would like to hear from your experience, sir.
Uh, thank you, sir. And I think you've been very kind in introducing. I think I'll speak from whatever experiences have been heard and shared by our partners all over the country. When you ask me the key challenges in translating these findings, uh, I'll enlist some seven of these challenges, and simultaneously how these can be addressed. I think number one challenge is the cultural sensitivity and appropriateness. These the research findings and whatever interventions that has to be done in this segment of population, it must be culturally sensitive and appropriate, because there's often a risk of misinterpretation or rejections if the interventions are perceived as disrespectful or disregarding any tribal customs and traditions. I think I can share this with you, work which we had done among Tendu collectors, which was household survey by an organization called as iForest Foundation. And this is a major challenge which we were facing in conducting those focus group discussions. So a lot more time was taken or gone in convincing the tribal, population leaders of the particular sect in the particular area that how this research or study is going to be relevant for them. So more than the research, getting us accustomed for the researcher is time taking. Second challenge is language and communication barriers. Communicating whatever research findings and the key messages that are generated, or what you call the product of the research, it should be effectively translated in diverse languages and dialects of tribal population, and this at times can be difficult and might require a lot of resources, because such kind of translators might be difficult to find out. Next is limited access to healthcare and information, because tribal communities themselves have often often have limited access to healthcare services and information. So it might be challenging to disseminate these findings and then implement policy changes. Fourth, socioeconomic constraints or restraints, because there's high level of poverty and limited education in such communities. This might restrict effectiveness of tobacco control measures which are working in the other sect of population. And immediate economic and survival concerns may take precedence over health issues. So it might look at some point that just tobacco control intervention is not that relevant, but there are bigger areas to deal with. Next is fifth is political and administrative hurdles, because while gaining the necessary support from political and other administrative players to implement that particular policy, it might be time consuming and challenging, especially in regions where tribal affairs are managed differently from the mainstream policies. Next is during the data collection and research, there might be certain limitation that could be logistical, ethical, or methodological issues, and we might not get the kind of high quality data of research that we are looking forward when which is required to create policy channels or policy windows for a particular intervention. And I think lastly, the key challenge in translation, which also was shared by Dr. Pragati, was not relying on the data, which is like a national data set. I think often we make this mistake and translate or triangulate our findings based on the national data set. I think more relevance should be on granular or ground level data rather than the national set, because this sect might be underrepresented there. So yeah, I think to address each challenge, I have communicated under all those 7 pointers what can be done. But if there are questions, I'll be happy to discuss. Thank you.
Sure, sir. We have similar experiences with our study also, because literacy level, as per I think, literacy level also plays a role. A literate people can answer in a structured way, where in case of I won't tell them illiterate, they're less educated. So what we have to do, we have to do several probing. Except that also we could not. It's very difficult to extract data from tribal population. So,
Right.
okay, sir.
Right.
Thanks.
I think one more point I would like to add. It's not a challenge, but maybe something which the panel can discuss. Like when we see the representation of tribal in the operational guidelines of NTCP, uh, we see that in the interministerial task force is where at the national level we have one representative of from the Ministry of Tribal Affairs, whereas how much representation happens at the district or the state level is yet to be realized and thought upon. And similarly, when we are talking about doing, someone does the research and then we are asking and requesting for those kind of policy measures for this population, I think it becomes really important to have one representative at all the level, be it block level, be it district level, or even the village level. So that's where we have to identify wherever the population is, and probably we have some representation. One good example which we have now is I think I did see someone who's working in Nasha Mukt Abhiyan in today's webinar. I think it was in the agenda. So in the Nasha Mukti Abhiyan, what I have come to know that there are groups which represent the block, and each group constitutes of at least one person from a tribal population. And again, when we say Nasha Mukti Abhiyan, the Nasha includes liquor, other addiction, or other abusive substances, including tobacco. So yes, I think that's a good example when we talk about policy and how we can integrate it there. So yeah, thank you.
So now I'd like to come to our next panelist, Pragati Heban ma'am. Ma'am, we would like to know from you that how collaborative research effort between academia, government agencies, and NGOs could maximize the translational value of the research findings for tobacco control and travel in indigenous communities.
Yeah, thank you for this question. I think when we think of translational value, the first and foremost thing is that a complete change in mindset is required, because the traditional sort of form of research is that the researcher comes, the researcher develops their question, they go ahead, do the research, come out with the findings, and then we think of translation. These are our findings and how do we translate? But especially in settings like this, the important way to go ahead is to develop the questions with the community. And I know this is easier said than done, because you need to be embedded in the setting, you need to understand the context, you need to empower and create spaces where community members can come, they can share their concerns. So like even Shivam was saying, it's not that tobacco control or health will be their first priority. They might have other challenges. So we work with them on their different challenges, and then slowly, once the trust is built, we can start working on tobacco, on health, and other issues after gaining their trust. So that is one important way of working collaboratively if we really want to translate these findings. One of our large center grants called Center for Training, Research and Innovation in Tribal Health is based out of BR Hills in southern Karnataka. And here we've had a long-term presence there. And now the community and the partners are so empowered that most of their questions shape and guide the research that we're doing. One example is of the tribal navigator model. So usually when the tribal people were encountering health challenges and they tried to reach out to larger cities, they were getting lost in the maze of, navigating and reaching care in time. And having one tribal youth from their community guide them through this process was found very relevant. So that was a small pilot. And now the Tribal Affairs Department has taken it up to scale it. So initiatives like these can, where empowering youth or participants from the community, can definitely be a collaborative exercise. I'd also like to, like even Shivam indicated, what would be the level of participation, say in our tobacco control committees by the tribal affairs representatives? Why not consider having a more active participation so that from the onset there could be a buy-in? And in terms of research, we should push ourselves to engage in more participatory processes. For example, more of action research, more of participatory action research, things like photo voice, or also having people empowering communities. For example, one other example could be on health communications. So where youth are empowered to take health messages. So it could be tobacco cessation, it could be tobacco harms. So it's a win-win. They learn communication skills, whereas the community gets the message in their own local language. To end with, I would just like to remember the scholar and activist Abhay Khaka through a few of his lines, which is very apt in this context of how do we work collaboratively. So the lines are, I'm not your data, nor am I your vote bank. I'm not your project or any exotic museum object. Your words, maps, figures, indicators, they all create illusions and put you on a pedestal from where you look down upon me. So I draw my own picture and invent my own grammar. I make my own tools to fight my own battle. For me, my people, my world, and my Adivasi self. Yeah, thank you.
Thank you, ma'am, for such an enriching in the panel. So to end, but what is the most important thing, I think, as a member of Institutional Research Committee, I would like to ask Dr. Shantanu sir, what ethical consideration we should take care about while designing research on tribal population?
Thank you, Dr. Bijit, for the question. I think majority of the thing has already been discussed by Dr. Pragati Hipar Madam and Dr. Shivam Kapoor as well. So I was the last quote that Dr. Pragati has given majority of the replies to it. I'm not your data, I'm not your vote bank. So I can paint my grammar in my own way. So and also one line Dr. Pragati has also told is that the traditional way of approaching them, like researcher comes, develops questions, does the study, puts the data, enters the data, will not work as we normally think for other situations. So first of all, like the ethical issue that should be taken is right from the beginning, we conceptualize a study involving tribal population. And that should be much more nuanced, much more thoughtful when we take subjects like tobacco use and tobacco control in indigenous populations in this country. So while devising the proposal, it should be in such a way that nowhere we are harming their interests, their traditional fabric, their cultural norms and their customs by the questioning pattern that we are asking them, nor by the language. For example, like someone of us are very well versed with English or Hindi, but we are entering into a tribal zone where they might not be knowing both the languages even. So they might be having their own dialect that should be known beforehand. And it's not a bad idea if we can rope in someone from that community to at least have an idea regarding the like what is the proper the predominant dialect like they might be knowing Hindi as well, they might be knowing English as well, but what would they prefer when we are planning a qualitative or a quantitative study? That is to be done. Second is that while approaching, we should know that at what part of the day they are free. For example, they might be very early risers and they might be ending the day at 5 o'clock or 6 o'clock. So it might be a very bad idea to enter into their, to take data, to approach them at a part of the time when they are actually going to the fields for their livelihood or they are working. So it should be noted in that way. Third is the attire of the researcher. For example, if you enter a tribal predominant zone with in a suited booted condition with a tie, they might think us to be someone from the government officials or someone from the police department, and they might not approach us. So our attire should be in such a way, the language, the demeanor, the body demeanor should be in such a way. Better that if we can rope in someone from the tribal, a young boy or someone, a person from the tribal community who can accompany us to know the cultural fabric, where we can go and where we can have more access to the tribal population, and we can sit down to discuss with them. Consent is very important in the language that they understand. It is also important. A prior knowledge of the tribal fabric is very important. And it should be in such a way that our questioning should not be threatening to them or should not be demeaning to them. That is very important. So we shouldn't give one-to-one questions. Questions like that, do you know about COTPA? Do you know about WHFCTC will not lead us to anywhere. So we can modulate our question in such a way using the proper dialect. We can use an interpreter who knows the language. Our body language should be very much comforting, by which we can at least navigate our questions to them so as to get a proper response from them. So I think these are some of the ethical issues that should be dealt with, even planned before we plan the study proper. Thank you.
Thank you, Dr. Shantanu sir. So with this, we are coming to the third end of the panel discussion. So I would now request any of the panelists if you want to say further something. Otherwise, I will conclude and take the questions. We'd also glad to have us with us Upendra Bhojani sir and Sonu Goyal sir with us. Whether they would also like to add something. In this.
I would just like to add one point, which I mentioned on chat, that I think it's also important to have more and more Adivasi researchers coming into such discussions and even others, so that their authentic lived experiences and their worldviews come. Because how much ever others try, that would not be their own worldview. So,
It's my very valid point raised by you, ma'am. So, Upendra Bhojani sir, would you like to add something to our discussion? But have been so fruitful till now.
Thank you. I think I was just patiently listening all the interventions, and I'm so glad that I think AIIMS Deoghar has emerged kind of as an institution which especially focus on tribal health. This is not the area we have discussed enough in tobacco control. I think I sort of found all the inputs very useful. Maybe because we also trained, research fellows to work on Adivasi health and on Adivasi research as part of the recently formulated center, which my colleague Dr. Pragati mentioned. Maybe I'll just mention those three. So we teach in those orientations, we teach three key pillars. And I think some of it was covered by Dr. Shantanu and others when we also reflected on the ethical aspects. So we talk about technical competence. So I think, first of all, I mean, doing good, technically sound research itself builds ethics, because otherwise, like it was mentioned, or just merely asking, do you know COTPA, do you know FCTC? It's like just putting our own professional categories to respond and said it doesn't actually yield much. We may be able to churn some data and present it, but I think we really need methodologically sound research approaches. Second is cultural safety. Again, I think in many different ways, various panelists articulated how cultural safety becomes a paramount while working with indigenous communities who, especially if you are a non-indigenous community researchers. And so I think our worldviews are extremely very different, right? So I think it's important to be to be mindful of cultural safety, and finally, what we call restorative justice. So I think we also should start by acknowledging that most of the indigenous communities have had to face, historical disadvantage over years. Not just being physically isolated, and that's why often neglected from the services, but also having faced social prejudice, being seen as out of the social mainstream. And I think there are a lot of things indeed we need to learn from indigenous communities and their worldview. But I think this is one thing we should keep in mind, because research and being able to research in India is absolutely a privilege. If we are able to do so, I think we should try to see how the research we pick up or the research we do with them actually not only leads to a research publication or maybe some evidence for a future policy, but actually changes something in their life in a more tangible way. That would be and towards a direction where there will be, more justice. The pendulum goes towards the justice. And so I think maybe those are the things we should also keep in mind as we sort of explore more this intersection between tobacco and indigenous communities and health. So again, many congratulations to AIIMS Deoghar team and all the panelists.
Thank you, sir. Kindly stay with us. I would request Deepak Mishra sir, Shivam Kapoor sir, and Pragati Hebal ma'am to switch on their videos if possible, for reporting purposes.
मेरा वीडियो नहीं चालू हो रहा है डॉक्टर विजय, कुछ तो
Shivam sir,
टेक्निकल
आप
ग्लिच है.
kindly.
I'm facing the same issue. I think I need to restart my laptop, so please excuse me for this.
Okay,
Thank
okay,
you.
okay. Thank you, sir. So very fruitful panel discussion we have today. We have also discussed what are the barriers like cultural sensitivity, administrative hurdles, logistical, ethical issues that may arise for tribal tobacco research. We have also heard that qualitative research may be more prudent compared to the. That's in the thanks. Not just so we have also had the qualitative approaches may be more fruitful because tribal population is difficult to get hold to. Quantitative research may be it's difficult to standardize. Pragati Hebal ma'am also told that the tool should be developed in consultation of the communities so that the contextual aspects may also be grasped, and there should be always involvement of the local leaders, and local participation should be there in any tobacco control measures, so that the intervention is not like designed in an AC room, not address the practical aspects of implementation in the ground level. So in case of meta-analysis could be also a fruitful research method. And while doing research in the tribal communities, consent is an important aspect because it's difficult to take consent in their own language. Ideally, interpreters should be there, and more practical aspect should be their tribal navigator model was being told by Pragati ma'am, and peer educator model is also to be very fruitful. So with this, I thank all the panelists to be part of the panel discussion. So now moving forward, I will ask the participants to kindly paste their question in the chat box so that we have various resource persons from all over the country. So if you have any doubts and queries, you can put in the chat box so that they can take the questions.
Dr. Vijit, can I take leave, sir?
Yes, sir. Yes, sir.
Thank you very much. Thank you, everyone, for listening us. Thank you.
So meanwhile, participants put the question. I would request. All the participants are requested to switch on their videos so that we can take a group photo of all of us. Whoever can kindly switch on their video. Not now, please. Can switch on their video so that we can take a group photo. Thank you. Kindly switch on your video so that we can take a group photo of all of us. participants, kindly switch on your videos so that we can take a group photo. दे दीजिए फोटो, ग्रुप फोटो लीजिए। So those who are participating, we would request, because we have promised in the beginning of the workshop, those who have filled the pre-test and post-test forms will be awarded a certificate from AIIMS Deoghar and Vital Strategies. So I would request all of you to kindly scan this QR code and fill the post-test form so that the certificate may be awarded to you. So meanwhile, you fill the post-test form. So I would like to thank all without whom the today's workshop would not have been possible. First of all, I would like to thank my Executive Director and CEO, Professor Dr. Saurabh Ashmi sir, for being patient and delivering such a long talk in the with this busy schedule. We are very thankful, and we've been always supporting and guiding us to organizing these kinds of workshops. So with your guidance, we will be sincerely emerge as one of the leading tobacco researchers of this country. So I would also like to thank Professor Dr. Sonu Goyal sir, who have spared his valuable time to bless us with his kind words on tobacco industry and tribal communities in India, status and possibilities for future. I would also like to extend my sincere thanks to my HOD, Professor Dr. G. Janvi ma'am. Without her support, the workshop would not have been possible. I would also like to extend my thanks to our esteemed panelists, Dr. Deepak Mishra sir, Dr. Pragati Hebbar ma'am, Dr. Shivam Kapoor sir, and Dr. Shantanu Nath sir to keep the time for this from the busy schedule for this workshop. I would also request, also like to extend my thanks to the co-PIs of the project, Dr. Vinayaga Murthy sir, Dr. Sudeep Bhattacharya sir, Dr. Ashad Ayub sir, for their support, without which the workshop would not have been possible. And moreover, I would more like to thank the project staff, Dr. Benazir Alam, Dr. Ujjwal Kumar, and Nivedita Jha for always being cooperative and supporting for organizing this workshop. And also, I would also like to extend our participants who have been joining us, listening to us since last 2 hours, especially Professor Dr. G. Janvi ma'am told me to especially thank Andaman Nicobar Institute of Medical Sciences. So we might be having many participants from that part of the country. It's very glad to have all of you in the workshop. And before concluding, so I think you have all scanned the QR code. I would also like to extend thanks to our IT department and the support staff who have, and our faculties who have attended this workshop. Without their support, would not have been possible. So before we end, we would hand over for the panelists. I would like to, for analysts and the resource person, I would like to share that the memento and certificate for this workshop will be posted to you meanwhile. And meanwhile, we can have some distribution here. So I would now request Professor Dr. Saurabh Ashmi sir to kindly, Sonu Goyal sir, if he's there, to present his participation certificate to him.
On behalf of AIIMS Deoghar, I'd like to thank all the participants, all the faculty, and congratulate the team AIIMS Deoghar for conducting so well. So this is certificate which will be sent to Dr. Sonu along with the memento for being a guest faculty for this. And this is for Mr. Deepak Mishra, that this will be sent to Mr. Deepak Mishra by post along with the memento. This is for Dr. Shivam Kapoor from Vital Strategies. This will be sent to you, and they want me to show the memento also. I'll do that. The memento certificate will be sent by post to the faculty.
Pragati ma'am. So that we will include.
Dr. Pragati, your certificate and memento will also be sent to my post. Okay. Thank you very much. And here we are. Thank you.
So, before we ending, we would also like to announce we will soon be conducting our 5th virtual workshop on tribal tobacco control next month. And after that, we will also conduct the national workshop, which will be a large event. The tentative date for which is the first week of May. So thank you, all of you, for joining us this evening to making this event a grand success. We are at AIIMS Deoghar are very pleased to have you with us. Thank you.